Hello everybody. I'm on my way to work right now. I have an hour 30 minutes to get to where I'm going. This is only 4:41. I should get there probably somewhere around 6:12, 6:13 by the grace of God. So I just wanted to make a video and talk to you guys about a typical 12-hour shift on the med-surg flow. A typical 12-hour shift on the med-surg flow. I've done both day shift and night shift, and I know what is involved. I pretty much know what is involved, so I just wanted to go through that. Oh my God. So when I get to work, the first things first, of course, you need to clock in. Yeah, so each hospital has its own, clocking in policy. Of course, the earliest time you can clock in, where I am at the hospital I'm working at right now, is 6:54. And then I remember at my previous facility, the earliest I could clock in was 6:38. Yeah, so depending on the hospital policy, you can't really just clock in and out at any time. They have their own rules that they have to follow. So of course, the first things first, you need to clock in. When you get there, you clock in, and then you have to look at your assignments, which patients have been assigned to you. Yeah, so on a typical med-surg flow, some places the maximum number is 5, some places the maximum number is 6, other places it can get to 7 or even 8 if you're very unfortunate. Yeah, but 5 is a good number. 5 is a typical good number. So you clock in, you check out your assignment, which patients are assigned to you, and then you start your day. You have to prioritize your time, because time management is of essence, of course. Time management is of essence. You have to know how to manage your time, because it's a med-surg flow and there's a lot going on. You have a lot of patients on your hands, and so you have to know how to prioritize. You have to know how to prioritize your time and all that. Yeah, so you've checked your assignment, you have your 5 patients, your 6 patients, and then when you get to work on time, what I mean on time is like you clock in probably a couple more minutes early enough so that you have a look at your patients, the tasks that you have for the day, for the night, and see what is important, what needs to be done. So on a typical shift, mostly you have to, the main big thing is, of course, medication. Your medication passes are the big thing on the med-surg floor most times. So you get there, you clocked in, you got an assignment, you check out your patients. You have your patients, you assign the patients that you have. You look at the tasks that you have for the shift, and then if you take notes, you can go ahead and take some notes and start your day. Because sometimes, I know there are people that would love to write things down so that you keep your stuff on track. Yeah, so you've done that, and then the next big thing, of course, is to get report from the person that was working the previous shift. You get your report. Of course, you note down what is important, if there are orders pending, if there is need to, there's certain things that needs to be carried on, you go ahead and do that. Yeah, so you got on your assignment, you've got on your report, you start your day. What is the most important thing? What is pending? So sometimes you get to work, it's 7, it's 8, and then your patients, some of them are asking for pain medication. Some of them are asking for this, some of them. So before you settle down, of course, you sort out your issues, and then you sit down and try and prioritize your time. Prioritize your time and see what is most important. How are you going to go ahead with your day? Yeah. So between 8 and 9, it's mostly medication passes. You pass your meds. You got up to about 10 o'clock. So what I usually do is during my med pass, that's the time I do my assessments as well. Yeah, during my med pass I do my assessment, because you have to do your assessment and all that stuff. So I pass my medication and assess my patients. It's easy, so that you don't really have to, you cut on going in and out of the patient's rooms and all that. Yeah, so I pass my meds. I also do my assessments in the room, so that I try to cluster my care as much as I can. Yeah, so when that is done, of course, you finish your medication passes, you have to sit down and do a bit of charting here and there. Your flow sheets, you did your assessments on the patients, but you have to enter now in your flow sheets. You do that, you catch up on your documentation and all that. And of course, call lights, those that need 2-hourly turnings, you check on them and all that stuff. Yeah, so it's one task at a time, really, one task at a time. So the main thing is just about prioritizing your time. It is very important to prioritize your time. Know what is important. Yeah. And then whatever orders were pending from the previous shift, you can go ahead and finish. Sometimes you might find that probably there were blood orders that went done. You can go ahead and administer the blood. If probably some potassium was ordered that wasn't given, you can go ahead and give. You just go through your charts and see what is most important, and I'll finish off from where your colleague left off. Yeah, so on a good day, you find that your patients are stable, nothing tragic happened. You didn't have to call a rapid response, you didn't have to code anybody. On a good day, that's a good shift. You thank your God, you move on. Yeah, so basically that's just about it. And then there are, of course, medications that are going to pop in and out. There are medications that are popping and out, medications that you have to give at 12 and 1, and then if you have blood sugar checks to do, you can do that and all that. So one task at a time, just like I say. But one important thing, of course, of all things, is time management is of utmost importance. You have to know how to manage your time. Yeah, so once you just get hold of that, you know how to manage your time efficiently, you won't really go wrong. Because many times you find that you have patients, and there's also stuff that happens. Family members want to be updated. You have probably a change in a patient's status. All that needs to be looked into. So one patient at a time, one task at a time. Go ahead and do what you got to do. Yeah. So thank you so much for your time. I just wanted you to give a rundown of what usually happens. Yeah, thank you. Bye bye.